Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist. In this presentation, I would like to talk to you about the side effects of blood pressure medications. The first of this group is what is called the water pills or the diuretics, namely hydrochlorothiazide or Lasix. The main side effects of these drugs are potassium loss and also weakness. People can get dehydrated if they lose too much fluid. The second group of drugs is called the ACE inhibitors. They go by the name lisinopril, enalapril, or ramapil. And these medications have a tendency to cause some dry cough from the chest because of the effect on the lungs. Then we have the third group of drugs known as ARBs or angiotensin receptor blockers. They are a kind of a hybrid of the ACE inhibitors, and the members in this group include losartan, talmosartan, and olmesartan. These medications, all blood pressure medications cause dizziness. It's important to understand that they can also have a tendency to increase your potassium level, which need to be monitored every 3 to 6 months by your primary care doctor. Next, we have the calcium channel blockers. These calcium channel blockers have been used for patients with heart disease, and it is also useful for reducing the blood pressure and also for controlling irregular heart rhythms. The calcium channel blockers have a tendency to cause dizziness. They can drop your blood pressure, and also it can cause some fluid retention, which is commonly seen with calcium channel blockers. The calcium channel blockers used in this group are amlodipine and nifedipine. Nifedipine has a tendency to increase the heart rate, which should be avoided in patients with heart disease because it can increase the heart work and cause symptoms. Then we have the beta blockers, which are very famous, which are most commonly used for treatment of heart patients, heart failure, atrial fibrillation, patients with angina pectoris, and the same medications can also reduce blood pressure, and they are routinely used in managing patients with high blood pressure. Beta blockers have a tendency to reduce the contractility of the heart. They also reduce the heart rate, which is a very important factor to keep in mind. Sometimes the heart rate can be in like 30s and 40s. If that's the case, either we have to cut down the dosage or maybe find a different medication that might do the same work. Beta blockers also have a tendency to cause like erectile dysfunction in male, and that is something people complain from time to time, and you need to pay attention to that symptom. Finally, we have a couple of other groups known as the aldosterone antagonists, which is usually used in patients with heart failure, which is aldactone and apelurine. And these medications help to lower the blood pressure. They also increase the potassium level. Remember that the diuretics reduce the potassium level, whereas the aldosterone antagonists, namely aldosterone or spironolactone, increases the potassium level. Same thing happens with angiotensin receptor blockers. That's the reason you need to have blood chemistries checked every 3 to 6 months. And finally, we have alpha blockers. They block the blood vessels, the alpha receptors in the body that constrict the blood vessels. So they dilate the blood vessels and help reduce the blood pressure. They also have a tendency to cause dizziness, fluid retention, and also sometimes they can cause depression. So these are some of the main medications used for hypertension and the side effects. Make a list of these side effects, and if you're taking these medications, pay attention to these symptoms, and if you're having any of these symptoms, do contact your cardiologist or primary doctor so they can appropriately adjust the dosages or do some modifications. Thank you so much. I am Dr. Nik Nikam. If you want me to research on any topic, please leave a comment and I'll be glad to look at the information and get you what you need to know. Thank you.